Hi, I'm Dr. Tam Cummings and I'm a gerontologist who specializes in dementia. Today what I'm going to do is explain to you what is the difference between dementia and Alzheimer's disease. Let's start by comparing dementia to cancer. Cancer is an umbrella term that means cells of the body have gone astray and are attacking the body. There are 438 identified cancers and all of the cancers have subsets. For example, if I said breast cancer, you might ask which breast cancer. If I said bone cancer, you would ask which bone cancer. Dementia is also an umbrella term. The original word dementia comes from a French physician who coined the word demence in 1834 to mean incapacitation of the mental faculties. But as Americans today, we don't understand that that's what dementia means. Dementia to us is a disease of the brain. In order for the disease to be dementia, it must be in 2 of the 14 lobes of the brain. It must be progressive, meaning your loved one will not recover and not get better. It must interfere with a person's ability to function, and by function we mean the ability to do the activities of daily living. The activities of daily living are transferring, ambulating, toileting, bathing, grooming, dressing, and eating. Dementia must interfere with your loved one's memory, and by memory we mean their ability to transfer, ambulate, toilet, bathe, groom, dress, and eat. We also mean their ability to understand language, sound, to recognize themselves and to recognize others, to be able to move their body without assistance from others. When the doctor told you your loved one has dementia and they're going to lose memory, the doctor meant the ability to do everything. There are 108 identified dementias, and the dementias have subsets too. So if you say Alzheimer's disease, I say which Alzheimer's? Lewy body dementia, which Lewy body? Parkinson's dementia, which Parkinson's? The dementias have subsets too. When we look at dementia care versus cancer care, we see some things that are significantly different. In cancer, the average family is a caregiver for 2 years. In dementia, the average family is a caregiver 10 or more years before they finally turn care over to a community. The death rate for the dementia family caregiver, our National Institutes of Health estimate that 1 in 10 family caregivers will die before the person who has the terminal illness. In cancer, the families know questions to ask. If you took your loved one to a general practitioner and they gave your loved one a 5-minute test and came out and said, well, she has cancer, come back in 6 months, you would say, no, that's not appropriate. You would begin to ask a series of questions that you've been taught to ask if the word is cancer. Those questions include, where is the cancer? Who will do the real testing? Where is my specialist? Are my grandchildren and children going to be affected by this disease process? Is there medication? Is there treatment? Where will we go for care? The questions that you ask for cancer are the same questions that you need to ask if the word is dementia. And at some point during the course of this disease with your loved one, when you reach a crossroads when you're not sure which way to go, change the word dementia to the word cancer and you'll know what the next set of questions are going to be. In cancer, there's always a miracle. Everybody knows somebody who should have died 6 years ago from their cancer diagnosis and they didn't. In dementia, there will be no miracle. The only thing that will feel like a miracle is that most of you will not have your loved one live to stage 7 of the disease. They will instead die in stage 5 or stage 6 of the disease from heart attack and stroke, just because that's how human beings die. And if you're listening to this today and you're thinking, I wish my loved one could just die tonight, I wish they could go to sleep and this could be over, that doesn't make you a bad person, that just makes you human. I have never met a family who wants to know how to make their loved one live into stage 7. Every family I've ever met thinks the same thing. Let this be over tonight and let it be peaceful. Now, if your loved one dies tonight, you didn't make that happen. That was just part of the disease and where their life was supposed to end. In cancer, when the loved one dies, the families have no measurable levels of guilt. And when we ask them why, they say, well, we did everything the doctors told us to do. When your loved one dies, you will very likely have overwhelming feelings of guilt. And the number one answer that you will give us is that you simply didn't do enough for your loved one. And yet I know that you've already done at least 10 years of care before I meet you, and I know that you've put your own health at risk. So I think you've done a great job of care. Families want to know, why do I need to know which dementia my loved one has? And the reasons are numerous. You need to know because the type of dementia your loved one has directly impacts your children and your grandchildren's health the same way a cancer diagnosis or a diabetes diagnosis would. You need to know the type of dementia your loved one has because the type of dementia determines how the disease will progress. It determines whether it will be a slow progression of the disease or whether it will be aggressive and rapid. The type of dementia tells you whether or not care is available. Some of the dementias are difficult to do care for, and you may have a challenge finding a community that is willing to take on the responsibility of care. The type of dementia that a person has determines the behaviors that you and I will anticipate as part of the disease. The type of dementia your loved one has determines whether or not there is medication. So it is critical that the same way we treat cancer by expecting to know what the disease is the same way that we treat dementia. We expect to know which one of the dementias your loved one has, and we expect you to know that as well. In cancer, you knew the questions to ask. In dementia, there are 5 questions that you really need to know the answer to, and the first one is, which form of dementia does your loved one have? Now later on, I'll go through the 9 most common forms of dementia, and we're going to try to help you understand how to recognize which one to go back and talk to your physician about. But every family needs to know which dementia it is. The second question for families is, do you understand your loved one's brain is dying, and do you understand how it's dying? If the disease is vascular dementia, caused by something going astray in the vascular system, then every time your loved one has one of these vascular events, they will have brain cells die due to a lack of oxygen. If it is one of the other forms of dementia, then the most common cause of death is going to be the failure of a protein. And the type of protein that fails is also indicative of the type of dementia your loved one has. So for example, if the dementia is a form of Alzheimer's, it is the tau protein and the APOE4 protein failing. If it is Lewy body dementias, it is the Lewy protein that is failing. If it is the FTD dementias, the frontal temporal group, then tau protein is also involved in failure. And if it is chronic traumatic encephalopathy, again, tau protein is involved. As tau protein fails in its job and the trigger for this failure is not yet understood, then the brain cell itself will have its roots begin to shrivel and tangle into what is called the neurofibrillary tangle. Once this occurs, the brain can no longer allow nutrition to pass through the blood-brain barrier and go to that particular cell. The cell will starve, die, and be removed from the brain in waste. You and I have a 3-pound brain. It has 100 billion brain cells doing trillions of activities per second. People with dementia are having their brain cells die. And at night, the dead brain cells are removed from the body in waste. If you and I lose a brain cell, our brain gives us a new one. People with dementia do not get new brain cells. By the end of the disease, if your loved one lives into stage 7, they will die with a 1-pound brain. And that's an important thing to remember. Your loved one's brain is dying. Everything they are doing is a direct result of the damage that's occurring in their brain. Dementias are terminal diseases because the brain runs the body. And when the brain can no longer operate the body dies. The next question for families is, has your loved one started falling yet? And yet, obviously, is telling us that they are going to fall. Everybody with dementia falls. It has nothing to do with care. People with dementia fall because of brain damage. These are diseases in the brain. And the way that you and I move, maintain our posture, have a gait, are able to stay in balance, all has to do with an area of our brain. The premotor cortex, the motor cortex, and the limbic system are destroyed during the course of this disease. And as a result of this, your loved one is going to have falls. Some of the falls are going to be quite devastating. Other falls are going to appear more like stumbles, where you may actually catch the person. We now know falls so well that the way your loved one falls is actually an indicator of the type of dementia they have. Alzheimer's people, for example, tend to fall backwards into a chair trying to get out of a chair. Because they fall backwards and land in the chair, we don't even notice that there was a fall. If the dementia is vascular dementia, their very common fall is that they try to stand from a chair, their blood pressure doesn't acclimate quickly enough, and instead of falling backward into the chair, this person is most likely to fall forward out of the chair, landing on their face, their elbows, and their knees. If the dementia is Lewy body dementia or Parkinson's disease dementia, these falls are related to a sudden loss of consciousness and chemistry changes in the brain that we don't yet understand. But what we do recognize is that in both forms of these dementias, the person will, as walking forward, suddenly stiffen like a plank and fall straight forward, landing on their face. When standing still, people with Lewy body dementia and Parkinson's disease dementia will suddenly stiffen and fall backwards, cracking the crown of their head. If the dementia is frontal temporal dementia, These dementias are located in the frontal lobes of the brain and the temporal lobes of the brain. If it's one of the dementias that is communication or behavioral, then by the end of the disease, these people are bent at their waist when they're walking. They are terribly out of balance. Their head is well in front of their body. They may experience 20 to 30 head falls a day towards the end of the disease as a result of still trying to move. And remember, people with dementia don't realize they can't move. So even if we have them in a wheelchair, even if we have them in a chair, they're going to continue to try to get up as the brain does its processing. If the dementia is Wernicke-Korsakoff, alcohol dementia, this person may fall in any direction. It depends upon how long the person abused alcohol. If the dementia is Huntington's, this is a familial dementia, and based upon the form of Huntington's, this person may have their limbs jerk in every different direction, making it extremely difficult for them to stand. Chronic traumatic encephalopathy is now the 9th most common form of dementia. This is commonly called football dementia, and one of the forms is a movement form. But we simply don't have enough research yet to understand which way these people will be most likely to fall. But everybody with dementia falls. And when you're thinking about people with dementia falling and your own loved one, be aware that we now will care plan in stage 6 of the disease for your loved one to not only fall, but for your loved one to break a hip, which will cause a fall. For years, people thought that a person with dementia fell and it was the impact with the floor that broke their hip. Now we understand that people with dementia are 6 times more likely to break bones than normal aging elderly. And part of this has to do with the damage to the brain and the inability of the brain to use vitamin D to maintain the skeletal structure. In stage 6 of the disease, we anticipate that many people with dementia will suffer what is known as a twist-turn fracture or a spiral fracture. The bone doesn't break because they hit the floor. The bone actually broke when the person stood and turned their body. The person may stand at the bed and turn and break their hip. They may stand from the table and turn, break their hip. Stand from the toilet and turn and break their hip. Because of the uniqueness of the disease, the hip may not break all the way through. Instead, it may fracture. And the person with dementia may walk around on that fracture for several hours or several days with no indicator of pain, again because of brain damage. When the hip does break, the person lands on the floor, and you thought it was the floor and ineptitude that caused the breakage in your loved one's body because no one told you it was the brain unable to maintain the skeletal structure. In stage 6 of the disease, if your loved one does suffer a spiral fracture of the hip, it means that the brain is now too damaged to maintain the skeletal structure, and it means that the end of life is coming. It does not mean that there was poor care. Everybody with dementia falls, and it is directly related to brain damage. The next question that you need to be able to answer is, has your loved one had a urinary tract infection yet, a UTI? UTIs are considered part of the disease of dementia, and they occur not because someone wasn't giving good care. They do not occur because someone was in a wet brief. They occur because a damaged brain cannot protect the body from infection. You and I have a 3-pound brain. If we decided not to drink anything for the rest of the day, we would go to bed tonight with a dry mouth, with a headache. We'd probably be cranky. When we wake up tomorrow morning, we would have a headache, still have a dry mouth, and probably be a little more cranky. But none of us would develop a urinary tract infection because all of us have a 3-pound brain. And the moment your brain senses infection, your brain will send white blood cells to go kill the infection. Your brain will send T cells to go kill the infection. Your brain will raise the body's core temperature, again, to kill infection. But your loved one doesn't have a 3-pound brain anymore. Their brain can no longer raise the body's temperature to what it should be. The body can no longer reach a temperature to kill infection. Urinary tract infections are actually part of the disease of dementia. They're a symptom of late-stage dementia. And towards the end of the disease, your loved one will develop one urinary tract infection after another. The nurses will notice, the CNAs will notice, they will take steps to protect the person and start them on antibiotics. They'll clear 10 days of antibiotics, appear to be okay for 2 days, and then the infection will come again. It's theorized that the infection never leaves the body because the brain cannot destroy it at this late stage of the disease. But urinary tract infections are part of the disease of dementia. Now, in 1984, we developed what is considered the gold standard of urinary tract infections. And what this box says is that delirium causes UTIs, and UTIs cause delirium. Delirium is a very dangerous thing to people with dementia. Delirium means that the chemistry of the brain is not being recognized by the brain. Hence, the body is in great peril. When dementia causes delirium to occur, one of the things that as caregivers we've always got to remember is that delirium is not necessarily cleared through a week at the hospital, through a set of antibiotics. If your loved one's behavior does not come back to its normal state that it was in before the delirium happened, then you need to be looking at, is the delirium still present? Delirium, we know, can last for days, weeks, or even months. If your person never seems to be the same following a bout with delirium, keep in mind to question and ask whether the delirium has actually been cleared. Urinary tract infections are part of the disease of dementia. They're actually a symptom in the late stages. We do things that cause people to lose fluid. We actually give people medications that cause them to lose fluid. Women have a greater risk of UTIs as we age just because we lose fluid through thinning vaginal walls. We can have people who have such great depression that even if we put the drink in front of them, they don't have the strength to lift it or swallow it. And because of depression, we know that people are more prone to UTIs. We give people medicines to make them pee. And even dementia people can figure out that you're giving me a pill that makes me want to go to the bathroom 30 times a day, and I'm not going to ask for help to go to the bathroom 30 times a day. I'll simply stop drinking fluid. And we know that people who have histories of restricted mobility and people who have histories of constipation or impaction are also at a higher risk for UTIs. So UTIs are part of the disease of dementia, and they do not occur because somebody forgot to change a wet brief. They occur because of brain damage. The fifth question every family needs to talk about is how guilty they feel. A lot of you have made promises to someone that you'll never place them somewhere. But I'm willing to bet that when you made a promise about a nursing home or a memory care community, it never occurred to you that your loved one could develop a disease like dementia. And that would be because it didn't occur to anyone else. Medical schools didn't teach anything about dementia until the mid-1980s, and today's teaching is literally a paragraph. The federal government didn't make a plan for people with dementia, so the states didn't make a plan for people with dementia. And now here we are in the midst of a medical crisis. So my question to you is simple. When it is time to move your loved one into care, do you plan to come back? Will you be back to do the care plan? Will you come back for birthdays and holidays? Will you be there to honor your person during holidays? Will your children and grandchildren visit? If you can say yes to this, you need to let the guilt go. You plan on driving up and dropping someone off and we don't see you again? Well, shame on you. You should feel guilty. Some of you are the children who have stepped up. Remember, if you are the sibling who has stepped up to take care for a parent, you are teaching your own children how to do care for you if something catastrophic happens. The siblings that aren't helping, they're teaching their children what to do to them in case of something catastrophic. So there's no need for you to take any more energy in that realm. They'll get theirs in the end. There are things that we can do for people with dementia, and there are things that we cannot do. And these are things that we really have to remember. The brain runs the body. So as the brain becomes more and more damaged, the body works less and less efficiently. Your loved one's reality is your reality. If she thinks it's 1970, it's 1970. If your 80-year-old mother now thinks she's 30, your 80-year-old mother is now 30. We use empathy. We're not lying. These people have brain damage. They have significant brain damage. Most people are not even diagnosed until they've already lost a half a pound of brain tissue. They have brain damage. They do not need the same amount of information you and I need to make a decision. In fact, they are usually needing to be removed from the decision-making process because of brain damage. That's important to remember. We're not lying to people. If she's looking for her mother and her mother's been dead 50 years, why in the world would we tell her her mother's dead? Because to her, it's as though it's the first time she's heard it. And why would we want to traumatize someone like that? They have brain damage. Their reality is your reality. The thing that you cannot do, the thing that really upsets professionals, is that we do things to people with dementia we don't do to people with any other form of disease. If someone has COPD, meaning they have chronic obstructive pulmonary disease, their lungs don't work right, they cannot breathe well, their family doesn't run up to them and scream at them to get up and breathe, to prove that they can breathe, to show us how sick their lungs are. If a family did that, we would think they were nuts. Somebody who has amputated legs, their family doesn't come up to them and demand they get up and walk down the hallway. They show that they can still use their limbs. The limbs aren't there anymore. We would look at that family as though they were nuts. But to somebody with brain damage, we come up and scream at them. We get very close to them. We get right in their faces and demand they tell us who we are. Now think for a minute how that feels. Have you ever been at a party and someone comes up and says, "Hey, do you remember me?" Except you don't. You feel an impact from that. It feels embarrassing. You find yourself sort of jumping around. Your brain's really reaching and searching, trying to find out how exactly do you know this person. And it's embarrassing. And all they did was from a far distance, your personal space, ask you if, "Hey, do you remember me?" They were not in your face demanding that you tell them who they are. Now I understand why you do this as a family. You do it because you think, if I try harder, she'll try harder, and today she'll get the answer. If I just make her keep using her brain, it'll somehow start working. She is using her brain. She's using every piece of her brain that still functions. And that's the best anybody can do. So be aware that the correct approach to your loved one is to look them in the eyes, to come from the front, to slow down, because it's a damaged brain. It needs a few more seconds to realize that you're approaching and who you are. And then your approach is, "Mom, it's me, Tam. I'm your favorite. I'm the good-looking one. I'm the smart one. I'm the one you liked best." I mean, if you're going to go do this, you might as well get in a good plug for yourself, right? You have to give them the clues as to who you are. And because I'm not in that person's face screaming, "Do you know who I am?" there's a very good chance that I may one more time trigger a memory of me. And even if I don't trigger a memory, I used my social skills, which will then cause this person's social skills to engage. It means that we can have something perhaps meaningful. But I'm not going to get anything pleasant if I come up and yell at my person to tell me who I am. Now, people with dementia have depression. You would be depressed if you could feel that your brain wasn't working right, that the information you knew should be there wasn't there. But the form of depression they're most likely to have is the form called atypical. People with atypical depression are angry, annoyed, agitated, and aggressive. Now, I either described your friends, your colleagues, your boss at work, or your loved one with dementia. The features of atypical depression are anger, annoyance, agitation, and aggression. The federal government has moved to withdraw the usage of antipsychotic medication in people with dementia for the simple reason that it causes them to die. It does not have the effect that it's designed for, and it's not intended for use with people with dementia. The medication that should be used is antidepressant medication. And we know now that the antidepressant dosage is going to be a much higher dosage than somebody else might get. And we know now that hospice needs to leave the antidepressant medication in place until the end of life. It does not get changed or altered as they enter hospice care. A nausea is the inability of a person with dementia to recognize that they have something wrong with them. You're upsetting your person with dementia because you keep pointing out what it is they're doing wrong. If they are asking for sugar and they reach for the salt, just hand them the sugar. You know what they're asking for. This is not a teaching moment. This is not a young brain that's growing. This is a brain that's dying. If we stop agitating them, they stop being agitated back with us. They're simply not aware that they're doing anything that's incorrect. So many times we are really bothering them because we keep trying to help them do something that they don't realize they're doing wrong. It has a name, and it's a nausea, the inability to recognize that you have dementia. Now, memory is a building block process. And memory, when the doctor said memory, a lot of families think the doctor means this person will become forgetful. What the doctor meant by memory is your ability to do everything, including breathe. The brain tells your heart how to beat. It tells your lungs how to breathe. It tells blood pressure what to do. It drives upper and lower digestion. The brain runs the body. And the brain holds memory, and memory is everything you and I can do. Memory is divided into short-term memory, sensory memory, and long-term memory. Sensory memory is when you were little, your mom said, "Don't touch that, it's hot," and you didn't know what hot was, so you touched it, and then you found out what hot was, and you didn't ever touch that again. Short-term memory is where the hippocampus and the limbic system are looking at information only for a few minutes or a few seconds, or it's pulling old memory out to use it for a few minutes or a few seconds to keep you safe. Think about short-term memory when you start your drive home. As you get on the highway, your memory and your senses are encountering things that are happening around it, and your brain is telling you, watch out for that truck's coming up too fast. That car in front of you is changing lanes, you need to get ready to move over. There's a red light coming up, there's an exit coming up, and oh my gosh, there's a cop. And when you get home, you find that you don't remember the drive home. A lot of times we get home and wonder if we even stopped at stop signs today. The reality is you stopped at stop signs, but your short-term memory took over and it was getting you home using little bits and pieces of memory, and when it was done with them, it threw them away because your brain didn't need them long-term. Long-term memory is also called lifetime memory. This is the memory that we associate with ourselves. Lifetime memory is divided into declarative memory. Declarative memory, think about this is what you learned at school. You went to school, they taught you a bunch of stuff, then they asked you a bunch of questions and you had to be able to answer it. You also have procedural memory. Procedural memory is when you have learned how to do something so well that you can do it without thinking. If I looked at you right now and said your shoe is untied, you don't think, oh, take a string and make a rabbit ear, take another string, make a rabbit ear, cross a rabbit ear, across a rabbit ear, pull a rabbit ear through a rabbit hole. You simply tie your shoe. Procedural memory is what allows you to do your activities of daily living. Transfer, ambulate, toilet, bathe, groom, dress, and eat. Bathing is our most complex memory. It takes more than 4 dozen steps to take a bath. When I tell you that, you think that's not true. It takes me 3. I just go. The reality is it took you 48, but your procedural memory is so good that you did it without thinking. Another form of memory that comes from declarative is semantic memory. These are events about not yourself, but facts, numbers, things that you know. The other form of memory is personal memory, memory about yourself. Personal memory includes memory of home, emotional memory, and home is one of our biggest emotional memories. If you're a family member caring for someone with dementia, there's going to come a point in time where they will ask you to go home. When they want to go home, they're not talking about drive them out to the ranch where they grew up. They're talking about a place that's full of emotion, not a tangible building. Home is one of the hardest things for families to understand. And there are 7 things we can do to make a home feel like home when it is time to move your loved one. These things are going to sound funny when I first say them, but when you put them together, it will make sense to you. The first thing that tells you your home is your pillow. When I say pillow, you got to think about pillows. Is your pillow soft, medium, or firm? Is your pillow cotton? Is it foam? Is it gel? Is it feather? Is it down? Is your pillow a regular sized, a king sized, or a body pillow? The second thing that makes home home is sheets. What kind of sheets do you like? Do you like linen, cotton, flannel, satin? Do you like your sheets crispy or do you like your sheets soft? What color do you like your sheets? Do you like white sheets, red sheets, blue sheets? If they're flannel, do you like them in plaid or do you like little snowmen on them? The third thing is the weight of your bed covers. What do your covers feel like when you're in bed? Do you need only a sheet or do you need a lot of covers? Now, when I'm home, I sleep on a regular sized gel pillow. I travel every week and I stay in nice places where there are no firm gel pillows. So the pillow right away tells me I'm not home. When I'm home, I sleep on linen sheets and they're not white. I've never slept on white sheets. My mother didn't put white sheets on our beds. When I go to hotels, every hotel in the country, sheets are white. So right away I know I'm not home. The sheets are the wrong color, they're the wrong texture, and the pillows are wrong. When I'm home, I have 2 quilts from my grandmother and a goose down comforter on my bed. So my bed covers are this thick and they have weight and substance to them. When I stay in hotels, and I stay in nice hotels, the bed covers are only this thick. So every night I know I'm not really home because it's the wrong pillow, the wrong sheets, and the wrong weight of bed covers. The next thing that makes home home is your art. Think about the last time you moved. You had the boxes undone, the kitchen was done, the bathrooms were done, but you didn't call it home until you hung your art on your wall. When you hung the art up, you said, yes, this is it, I'm home now. Home is the pictures of your family. When I get home, I have pictures of 17 nieces and nephews, great nieces and nephews, great-grandparents, grandparents, parents, and siblings. Those pictures tell me I'm home. The sixth thing that makes home home is your chair. Because of how I travel and because of where I live, I sometimes don't get home until 4 in the morning, but before I go to bed, I sit in my chair. Because that's my chair, it tells me I'm home. The last thing that will make home home for your loved one is a smell. And I don't know that smell. You don't know that smell, but you do know your loved one's favorite cologne or perfume. We're going to ask you to bring that when it's time to move them. And during the day, spray it on the lamp in the room and turn the lamp on, and the room will take on an odor that your loved one enjoys. And those 7 things are what make home home. Also remember, when your loved one is asking to go home, they are now quite advanced in the dementia process. And when we think back to children and how children are, children from the ages of 2 to 8 are the ones who ask to go home. If your loved one is asking to go home, it means that they need emotional support right now. It means that they're simply looking for that feeling of being safe at home. So we talked about what memory is, but here's another way to think about it. Think about every memory you have as being a file, and think about your brain being the file cabinet. Memory started in your moment of birth. You met the first person who you began to make a file on, and that person was Mom. When Mom and Dad left the hospital, they took you home. When you got home, you met people. You met siblings, cousins, aunts, uncles, grandparents. People came to meet you on the day you were born. In the first 6 years of your life, your parents begin to teach you the same things their parents taught them, the very same things you've taught your own children. By the time you were 1.5 years, you were expected to be saying please and thank you. When you were 2 years old, you were starting to say yes ma'am and yes sir. At 2 years old, your parents begin teaching you the social conversation, and the social conversation is I say hi, how are you? And you say, oh, I'm fine. And I say, oh, I'm fine too. How's your family? And you say, oh, my family's fine. How's your family? And I say, oh, they're fine. How's work? Work is fine. My work is fine. How's the weather? The weather is fine. My weather is fine. It's not a real conversation. It's simply a memorized, polite thing to say to people. The reason the answer to every question is fine is because your mama told you a long time ago that nobody cares how you're really feeling. It's not a question about that. It's just simply a social conversation. The problem with the social conversation is it's been learned since you were very young, and so even professionals get fooled if they accidentally engage your loved one's social conversation. So for example, walking into a doctor's office, it's not unusual that the doctor says, hi, how are you? And your loved one will immediately respond with, I'm fine, how are you? That can leave you very, very frustrated. They're not doing anything on purpose. They're simply responding to the stimuli that I began the social conversation. In the first few years of your life, you learned your activities of daily living: transfer, ambulate, toilet, bathe, groom, dress, eating. Bathing took the longest to learn. You were 8, 9, or 10 before your parent believed you could safely and correctly bathe. You begin to learn your spiritual or religious beliefs. You begin to learn how the family's actually connected. In the beginning, when someone tried to tell you that grandma was actually their mother and you're actually their grandpa's sister, that was very confusing to you. That didn't make any sense. By the time you start reaching 6, you're beginning to understand the interrelations of family connections. You begin to learn singing. You begin to learn cussing. Mom and Dad sent you to school. You went to school to learn 3 things. You learned reading, writing, and arithmetic. You might have learned a musical instrument. You played a bunch of ball games. You had your first date, your first love, and your first kiss. You graduated high school and your parents said you got to go. You can go to work, you can go to the military, you can go to college. You're not staying here, you got to go. And so you left and went out into the world. Can you remember your very first apartment? Would you live there again? Have you ever wondered why Mama made you live there? Kind of interesting. You went out into the world, you got an apartment you loved, you met someone, you fell in love, you got married, and you had children. From those children, you got the grandchildren, the ones that you actually like. And from the grandchildren, you get the great-grandchildren. And with the great-grandchildren comes retirement, and then in most forms of dementia, the disease process begins to start, and it begins to remove memory in the reverse order of which it was learned. So now I'm going to take you back through the filing cabinet, and this time I'm going to use my mother as the example to help you understand what's happening to your loved one. My mother was born at home on what is now Fort Hood, Texas. When my mother was 3, the federal government took Fort Hood, and my mother's family moved further west into the county and started new ranches. When my mother was 6, she got a set of twin sisters, and those are her only siblings. But my mother has a large family. She had 63 first cousins, including double cousins. Double cousins are because my grandmother and her sister married a set of brothers. My mother began school when she was 6 years old. She first walked 2 miles through a pasture on the ranch called Copperhead Hill. She climbed over a barbed wire fence, walked 2 more miles down a dirt road, was picked up and taken to a one-room schoolhouse. In the afternoon, she was dropped off, walked 2 miles back down a dirt road, climbed over a barbed wire fence, and walked 2 miles home through Copperhead Hill. Kind of makes you wonder what would happen today if we did that to a child. I'm thinking CPS would come to visit us. When my mother was in the 3rd grade, the federal government closed one-room schoolhouses, and my mother began to get on a bus and go to a school with 15 rooms, one for each of the 12 grades, one for the nurse, one for the kitchen, and a cafeteria-library combo. My mother, who could walk 8 miles as a 6-year-old, could only play half-court basketball because the federal government said she wasn't strong enough until 1974. Until that time, girls played half-court basketball, not full basketball. My mother was the cheerleader. She was the homecoming queen, and the day after she graduated high school, she married my father. By the time my mother was 30, she and my father had 5 small children, and I would be 10. From those 5 children, my mother has 12 living grandchildren. From the first 6 of those grandchildren, my mother has 17 great-grandchildren. 12 of them are under the age of 5. The others are between the age of 7 and 13. Now, when you know my mother's file cabinet, there's a few other things you need to know. My mother's father lived until he was 63. He died of lung cancer. My mother's mother lived until 2003. She died of vascular disease. And now, because of dementia, my mother doesn't realize the year is 2020. My mother thinks the year is 1970. And if the year is 1970, she's not an 80-year-old woman. She's a 30-year-old woman with 5 small children. I go to my mother, I get in her personal space, I fix her lipstick, I comb her hair, I put her earrings on her. And when I say to her, "I'm your daughter," my mother says, "No, you're not." And the reason she says I'm not her daughter is because with the files that are left in her brain, her daughter can only be 10 years old, and I am not 10 years old. My mother will then look through her file cabinet to try to give me someone else's file in order for her world around her to make sense. The most common thing daughters are going to become is we become the mothers or the wives. Sons become the husbands or the fathers. One of the reasons your building wants to know information about your family life is if you know my mother's information, you know that at 58, I am the age of her mother and I greatly resemble her mother. So when I go to my mother, she doesn't think I'm her daughter because there is no file of me as an adult. She thinks instead, I must be her mother. That's the file that makes the most sense for her. She's not doing this to hurt my feelings. She's not doing this to embarrass me. She is doing this because she's trying to find a place for me that makes sense to her in her brain. Now the next question is, who does my mother think my 85-year-old father is? And it's not husband, because she's a 30-year-old woman. She's not married to that old man. Again, if you look at our family history, you find out that my mother thinks my father must be her grandfather, and my mother actually had both grandfathers live with her before the end of their life. My mother sees my 50-year-old brother, and she doesn't think that's my son because, again, in her file cabinet, her son is a small child. Instead, she thinks, there goes my husband. Not because of some weird sexual thing, but because how many of you have a son who is the spitting image of his father? How many of you have a son with the same name as his father? She knows she's married, and she's not married to that old man in the house. Her husband must be this younger Jimmy, because that Jimmy more closely matches the timeline of where her brain now is. When my mother looks for her children, she doesn't see me as her child or my brother or my siblings, and she doesn't see her grandchildren as her children because they're simply too old. Instead, my mother looks at her 17 great-grandchildren and decides that those people must be her actual children because they not only look like us, but they match the timeline of where her brain files are now. It's not anything she's doing on purpose. It's not anything she's doing to hurt anyone's feelings. She's simply trying to put the people around her into a slot in her brain that make the most sense for her. All of the extra great-grandchildren, the grandchildren, the siblings, we're simply part of the first cousin set that she has. Now that doesn't mean in this moment, in this flash, my mother doesn't suddenly know me, because the brain is trying to find pathways to memory. And so she may have a memory for a moment of actually knowing who I am. But then that memory is gone again, and I go back to being her mother. Now I go to my mother and I say, I'm your daughter, and my mother says, I'm sorry, I was never married. So if my mother hasn't been married and doesn't have children, that tells me that she got married the day after she graduated high school. Therefore, if she doesn't remember being married, we must be somewhere before high school. That doesn't mean that I can't have a conversation with my mother. It just means that I have to pay attention to the limits of her file cabinet. My mother grew up on a ranch. I can ask my mother all sorts of ranch questions. How do you milk a cow? How do you turn milk into cream into butter? How do you make bread? How do you do preserves? I can have a great conversation with my mother. I can talk about being a cheerleader, being a point guard. What is that like? I can have a good conversation as long as I respect the boundaries of her file cabinet. As the disease progresses, and remember, dementia never stops killing brain cells. Your loved one is losing brain cells as we're speaking. They will go to sleep tonight with fewer brain cells than they woke up with, and they will wake up tomorrow with even fewer. As the disease progresses, my mother will no longer recognize any of us, but she will continue to seek a way to go home. And remember, the thing that we do to make home home are those 7 things. And recognize that when she's wanting to go home, this is no longer my 80-year-old mother. This is now my mother as somewhere between a 2-year-old and an 8-year-old. And that's the person I respond to. I don't yell at her and tell her she's already home. I don't yell at her because she doesn't recognize home. I must recognize that my mother has significant brain damage, and I'm responsible for making her feel as comfortable as possible.